Hey, welcome back to the Heart Health series. Today we're going to be talking about how to lower your cholesterol naturally. So I want to begin with this. Do we live in a healthy or sick country? Listen, America makes up 4% of the world's population, and yet we consume over 50% of all prescribed medications, and we spend over 50% of all the money on medical care. I mean, despite the advances in medicine, Americans are less healthy than they used to be. And the next generation may be even worse off. We've got to do something different about our health. So, one of the things that most people turn to when they have high cholesterol is statins. And statins are most frequently associated with myopathy, which is muscle pain. And when you look at this list here, the medications from the top to bottom go from the most symptoms to the least. And some of these you may be familiar with, and some of them you may not be familiar with. And so Lipitor and Crestor are probably the two most common ones that you will hear, but note there are many other statins that are being prescribed that have many side effects. And remember, statins do not affect that Lp(a) number on your blood work. It will not change that. Only lifestyle and some specific supplementations will do that. Listen, when you are on statins, not only does it cause myopathies, it also increases your risk for diabetes by 48%. And not just adult onset diabetes, it's type 2 diabetes and type 3 diabetes. Type 3 diabetes is the new coined phrase for early onset dementia and Alzheimer's. Because what happens is when you take a statin, it chemically lowers your cholesterol. And cholesterol is actually needed for brain health. So if your brain's not getting enough cholesterol, enough healthy fat, then it literally shrivels up and leads to that type 3 diabetes or Alzheimer's. So you want to make sure that you really address your health in a natural way, not just for your heart, but for your brain. So let food be thy medicine and medicine be thy food. So when we talk about food, food is a mixture of 3 macros: proteins, carbohydrates, and fats. And all of these food groups give you the proper nutrients you need to be healthy. But how much of those foods should you eat? So you could go by this diagram. So in terms of the palm, that's the amount of protein you should have. The fist is your carbohydrates. In terms of the starchy carbohydrates, like rice, potatoes, squashes, things like that. Not the carbohydrates that come from fibrous fruits and vegetables. And then the thumbs are the amounts of fats that you should have per your meal. So let's talk a little bit about fats. So plant sterols, or fats from things like avocado, they support healthy cholesterol levels. As a matter of fact, the NIH recommends a consumption of 2 grams of plant sterols daily, along with healthy eating and exercise to reduce the risk of cardiovascular disease. And studies have shown that 1.3 grams of plant sterols per day, not just every once in a while, but per day, are needed to show a significant cholesterol lowering effect. So foods can help your body heal. Here's the biggest one, and that's protein. Most people skimp on the protein, but protein should be at every meal. Protein is so critical for your body. It helps with the formation of all of your cells. It provides certain nutrients to help your body make other nutrients, including enzymes that help with a lot of different chemical processes in the body. So you want to make sure that you have protein, a good, clean, grass-fed organic protein at every meal. So here's some tips to a successful program with utilizing nutrition. So don't skip your meals. Always eat your breakfast. Listen, even if you like to do what they call intermittent fasting or time-restricted eating, you can still have 3 meals a day. They're just pushed off at a later time. But today's not about intermittent fasting. It's really about just getting you to eat a healthy diet. You want to eat more slowly. You want to snack at home before going out so that you don't gorge when you're out at a restaurant. This is my favorite, and that's shopping the perimeter of the store. When you go down those center aisles, that's where all the boxed, pre-made foods are that are not adding anything to your health. Go wild, organic, and free range as much as you can. And here's another big one that I love is planning your menus ahead of time and never go to the store hungry. But if you fail to plan to fail. Once you get to back home from the grocery store, wash, chop, and prep your food right away because then you have no excuses later on to not use that food. And then always pack your food. It doesn't take long to prep your meals ahead of time and be able to grab and go and to work with your meals. So here are some specific nutrients that will help to lower that LDL, that lousy loser bad cholesterol. The most common that people have heard about would be things like gluten-free oats and then fibrous fruits, as you see on the screen. But here's some lesser known nutrients. One is fish oil or essential fatty acids. Some people know it as omega oil, fish oil. So fish oil will help to lower LDL. But again, not all fish oil is created equal. So you want to make sure you have a great quality fish oil, and you want to make sure you're taking the fish oil amount that your body needs and for your genetic type. So one of the things that we do in functional medicine is we look at some different genetic factors that help us to determine the best kind of omega oils and the best amount that a person should take. Because if you are a certain genetic type and you take too much omega oil, it can actually elevate your LDL. If you're not taking enough and you're a certain genetic type, your LDLs will never come down. So it's really critical to know those numbers so we know how to address you personally with your specific nutrients. And then down on the bottom, there's some spices that really help with lowering LDL, and that's things like curcumin and turmeric. So another avenue to help with lowering cholesterol, but actually increasing HDL. So remember the happy, healthy cholesterol is exercise. Exercise actually elevates your HDL. So how do you want to age? I mean, if you knew you were going to live to 94, when would you start to get healthy? Is it after you've gotten sick, or should you do it before? So let's do it before. And exercise is a huge component to your health. And listen, you don't have to go out and become a power lifter or a marathon runner. Just 30 minutes of brisk walking 5 days a week is a great start. Adding resistance training to your workout helps to build muscle. Resistance training also helps to prevent against osteoporosis. And then, of course, stretching will help to improve flexibility and aid in your muscle recovery. So if movement is part of the solution, what keeps you from moving? If you have aches and pains, you need to address that, and not necessarily with aspirin or ibuprofen or Tylenol, because your body's not lacking those things. So you really need to address the root cause of the pain as well. And this is absolutely where chiropractic can come into play. Listen, most people associate chiropractic with back and neck pain, and we certainly help with that. But chiropractic is a lot more than that. Chiropractic addresses how the nervous system is functioning, and the better you live your life through your nervous system. And if your nervous system is working properly for you, your body's going to function and work properly. So make sure that you address what's keeping you from moving. And this is another big one, lowering your stress. We talked about this in the last workshop, and that is, stress will actually elevate more than just your cholesterol. So you need to learn ways to reduce your stress, because we can't get rid of it. We will never be able to get rid of all of our stress, but we have to learn how to deal with it more appropriately in order to have better health and well-being. So one of the things that you can work on is meditation. Meditation, I'm telling you, I know a lot of people, myself included, it's really hard. But there is so many different programs out there that are free. You can just jump on YouTube and you can find 1-minute meditations, 3-minute meditations, and build up from there. Meditating helps to move you out of that fight or flight pattern. Okay, it helps you to just kind of reset and just take a break And it will help to actually boost your willpower, because in the beginning, it's really hard to meditate, because I'm telling you, I'm sure you're going to think of like 20 other things going on around you, but this will really help to bring you into focus and help you to better handle your stress. So I want to share with you here one of a past patient who had health issues. One of them was high cholesterol and a history of heart disease. And so we did a pre and post blood work, and you can see it here. And you can just take a look. The pre total cholesterol was 308. I mean, the LDL was 216. I mean, she was way out of balance. And so I put her on a very specific 21-day program utilizing nutrition and things like that. And look what happened in just 21 days. This is her blood work, 21 days. Cholesterol 201, LDL 140. Does it need some work? Absolutely. But is she more heart protected? Yes. Because look at her HDL. Her HDL went up to 67, which is fantastic because women need to be over 65. Her triglycerides came down, and even her glucose, which didn't necessarily need to come down, came down too. So this is a person who we just saved her life and increased her longevity and just helped with her health and well-being. So how did she do it? Well, we did she was eating better. We did a 21-day specific diet with her that included quality supplementations. We got her exercising, and of course, chiropractic adjustments. Again, chiropractic adjustments help to regulate what the nervous system is doing and helps the body to function better. So when we talk about health, and we talk about especially like with functional medicine and things like that, there's a lot of pieces to the puzzle that we put into play. With functional medicine, we always do different health assessments, health satisfaction survey. We always look at blood pressure, body and posture composition, because remember, we talked about those metabolic risks. So that's where the posture and body composition comes into play, core flexibility and strength, and then those blood tests. So we look at a lot of different factors when it comes to looking at your health and well-being, and to be personalized with your health program. So it only takes one habit a day, every day, to improve your health. So just doing one new daily habit that's going to add to your health is going to improve your health. I mean, think about that. If you just added one healthy thing every day for the next 365 days, in a year, you're going to be a completely turned around person in regards to your health. So listen, the only solution for a lifestyle problem is a lifestyle solution. And that's where functional medicine can really come into play. And even chiropractic care can come into play. Because if you're not eating well, if you're not exercising, if you're not taking care of yourself, you are going to have some type of health condition, and it's going to be something that you brought on yourself. So the only way that you can change that is to change that lifestyle. And certainly getting healthy with functional medicine is a place to start. So find somebody in your area that can help you really get on the road to better health, utilizing a personal protocol based on you. If you would like to work with me, you can always call my office. Here's the number right here, 639-1100. You can always follow us on Facebook, Sens Family Chiropractic and Functional Medicine. But if you want to work with me, call our office and just let them know that you watched this video and you're interested in getting started in functional medicine. All right, guys, so I hope you enjoyed this series. Check back here for more series on different health topics, but it was great to talk to you, and we'll see you next time.